As healthcare professionals, it's our job to optimize the health of the people we serve. And no one, hopefully no one, would see a little problem with a tooth and say, we should take that out and put in an implant and do all this complicated stuff. What had become conservative, simple restorations is now actually over-treatment in a lot of cases. And so it would make sense, if the problem is not severe, to use sort of the least expensive, least invasive, least destructive approach that we have. You know, if it can be solved with a little bit of changing the diet or a little brushing technique, that's what we should do. If it does indicate some medicines, if that is, you know, the diet's not going to change enough or whatever it is, then we use some medicines. If the medicines aren't enough, then we can combine them with the traditional restorative approach. If that's not enough, then yeah, maybe there's other things that need to be done. If a tooth is cracked in half, unfortunately, it probably needs to come out. But we now have a wider array of care. And so just like if you had a problem and you could solve it yourself, you would want your care team to tell you, you know, oh, take the splinter out. Don't chop off the leg. You know, we have a new range of care. And so it would make sense, I think, to everyone for that to be offered first. Physically invasive treatment has been the norm for dentistry for 150,000 years, I don't know. When you have medicines that just soak into the problem area, you're not affecting the rest of the body. You have a little bit of medicine, you put it into or onto a cavity. That medicine just goes into the tooth, and that's kind of it. When you have a traditional mode where you're physically removing, mechanically removing the problematic area and then replacing it with stuff, you have a needle that gives local anesthetic. That local anesthetic travels throughout the body. So you have multiple medicines in the local anesthetic that are being introduced to the body. You have to isolate the area much more intensely. So now you're starting to poke other areas around the tooth, into the gums and all of that. And you have other foreign materials like plastic composite resins that are kind of not based in the nature of the human or the physiology of the human. So you have all these other materials that are being introduced, and a lot of which go into the body that may or may not be healthy for us. If in addition you have someone who is anxious or not able to cooperate or tolerate normal traditional dental care, then you're also using medicines to sedate them, and so that those medicines can go into the body. And it seems like there's long-term effects from some of those medicines, and the FDA has issued black box warnings against the higher level sedatives. So you have all of that versus a little bit of cotton, a little medicine that goes onto the tooth and soaks in. So the level of safety for these two different things, both psychological and physiologic, are really a whole different ballgame.